Okay, folks, here's another video. I'm looking for this. I thought I lost this, but here. He's interviewing Thom Hartmann. David Pakman's interviewing Thom Hartmann. They're talking about healthcare, and he has another book, I think. Program. In the description, Thom Hartmann, host of Thom Hartmann program, has a latest book. Oh, the hidden history of health, hidden history of American healthcare. So this was about a year ago, but this is interesting, folks. He tells you why America doesn't have single-payer healthcare. This is very shocking. I'm gonna make comments here and there. I'm gonna react to this, but this is why, folks. Here's the video. Yeah, here we go.
To the program, Thom Hartmann, who is of course host of the Thom Hartmann program, author of the Hidden History series. The latest installment is The Hidden History of American Healthcare: Why Sickness Bankrupts You and Makes Others Insanely Rich. Great to have you back on, Thom.
Thank you, David. It's great to be here.
So I've talked about this a little bit before. Wendell Potter has written about this particular thing I'm going to ask you about. Uwe Reinhardt in his...
I think he's the insurance, he's ex-insurance guy. And he made a book about it. I think he read a book about the insurance system in the US. He made a book about this. All the scams and all this scam. It's a big scam. The insurance company does. All these health insurance, basically. And what they do to the people. I mean, it's terrible.
His last book wrote about it. There was a point in time in the US in the early 20th century where it was sort of looking like we may be going in the direction of, if not a straight out single payer system, something much more like what Germany and some other European countries have. And that was short circuited, and there are important political and historical stories to be told about that. To pick that maybe as our entry point, what happened during that time that derailed that path for the United States?
Which are you talking about? Teddy Roosevelt, 1912?
Right, wait, I should clarify because there's more than one. Yeah, so Roosevelt in 12 and the period between World War I and World War II was relevant. I mean, feel free to jump in wherever makes sense to start the story.
Yeah, well, we've had multiple American presidents suggest this, and it has, and it's not like we didn't have a role model. I mean, Germany got this in 1884, and it was from Otto von Bismarck, who was no flaming liberal. He saw it as a way of strengthening Germany and building industrial policy and mollifying the masses. For a whole bunch of his own reasons that were ultimately good for the country as well. And we've had a number of politicians who have tried to bring it about. The thing that blew it up back then, which is quite different from what's blowing it up right now, or somewhat different, was Frederick Hoffman and the Prudential Insurance Company or what was then the Prudential Insurance Company, and this whole program called scientific racism that even President Woodrow Wilson, the Democrat, had bought into, as well as pretty much everybody else. And that really started in the 1790s.
This guy was a racist, folks. Woodrow Wilson, he was a racist, straight out, 100%.
When Hoffman came over here from Germany, he was a young man, married a Southern belle down in Georgia. He was an absolute genius with numbers. He was the guy who, working for Prudential, he worked his way up to vice president. He was the guy who figured out that there was an association between lung cancer and mesothelioma, between smoking and lung cancer, between asbestos and mesothelioma. And he wrote a book about the association between processed food diet and cancer, which is still in print. So he was a big deal at the time. And he did the math on mortality and morbidity for white versus black people and came to the conclusion, influenced heavily by his wife and the environment in Georgia where he was living, came to the conclusion that black people were so genetically inferior that if we simply denied them health care for a couple of generations, it would, quote, solve race problem in America because they would all die out. And he
You hear that, folks? You hear that? They're gonna die out. They're gonna die out. These people, yeah. The terrible people back then, and now these people are still around, folks. People like that are gonna die out. They want to kill off the melanated people, and plus the powers that be. I said they really want to do, but that's another story.
this plugged into a program that he had helped start called scientific racism, which then led to eugenics in the 1920s, that Hitler picked up in the 1930s. And that idea,
Hitler, yep. See that?
that if we simply deny health care to black people for a couple generations, it will cause them all to die out, or many of them, most of them, not only animated the anti-health care movement throughout the early 20s.
You wonder why there's still a difference today, folks, when black people get sick and go to the hospital. I mean, they get treated. They said there's a healthcare. Till today, there's still a healthcare racism in the health industry towards black people in America. And you wonder something that's still going on. They think like that. Yeah, I mean, of course the powers that be, but saying that on the lower level, they disregard black people. They treat it differently there. I mean, wow.
20th century. It's the reason that Southern senators, the Democrats at the time, the Dixiecrats, fought to have a 20% hole in Medicare in the 1960s, because they felt that that would make it very, very difficult for black people to get any kind of health care. They didn't want them showing up in white hospitals or white doctors' offices, even if they were over 65. And that was the shtick. I'm not sure if there's a specific other incident that you're thinking of that you'd like to.
That's a lot of the one other is, and I think it's Wendell Potter who wrote about this specific element, which was that between World War I and World War II, there was a sort of renewed push for going in the direction of a single payer system in the U.S., but sort of for political posturing reasons, it felt and sounded too German at a time.
See, they would have had a single payer, folks.
When that was politically inconvenient, and that also created a roadblock at another time where there was some momentum building.
Well, Frederick Hoffman actually wrote a series of pamphlets about that and gave numerous speeches saying, I'm from Germany, and he was a rabid anti-communist by that time. I'm from Germany, and this program that Bismarck started is really communism in disguise, and you don't want this. And I mean, he became the principal, he died in 1946. He became the principal spokesperson throughout that period, basically from 1905 to 1940, 1945, against a national health care policy. His principal argument was the racial argument. He also had the chops, the cred.
Wow.
To say, I'm a German, I was born in Germany, I lived under that system, and it sucks. And you don't want it. So, those two things combined, and there were obviously a lot of other people who were echoing what he was saying.
When you think about the situation now that we have with healthcare in the United States, in terms of it as a for-profit system, in terms of a system that is contained within states, do you have a sense that the most radical change, to use that term not pejoratively, but the most drastic change is likely to come from within individual states that want to try different things, or do you believe that the most radical change is likely to come from the federal level down?
I'm guessing it's going to happen from the states for two reasons. One, because that's how it happened in Canada, and we're very culturally and politically similar to Canada. And Saskatchewan got this in the 1960s, and then
Yep, Tommy Douglas, folks. The father of, I don't say the father of single payer, well, in Canada anyways. Father of the healthcare we have here.
Other provinces around them said, "Whoa, that really works well, and it saves money. Huh? Let's do that." And it spread across the country, and eventually the federal government got into the act and said, "Okay, we will backstop you guys and offer some standards." But every province in Canada has their own different Medicare system that does cover all of their people, but some cover dental and some don't. I mean, there's subtle differences between provinces. We have in the United States both California and Vermont that have passed legislation turning their states into single-payer states. The problem that we have in the United States is one that I never really was able to find out if this was put into law in order to prevent single-payer, or if it's just how the clumsy aspect of how the laws were written. But one of my best friends was the head of health, education, and welfare in Vermont when Vermont decided to go single payer, and they got the legislature to pass it, and the governor to sign it, and everything, and he was tasked with putting it together. And what he found was that the federal law says that Medicare payments can go through the Medicare system directly to Medicare recipients, and Medicaid can go through the state, but it has to go to Medicaid recipients, but it has to go through a system that's basically called Medicaid, or the state version of it. Different states, particularly for children, have their own little branded versions. But there's very clear definitions of how that money has to flow, probably largely to prevent fraud or states from making off with it. But what that means is that if Vermont was to go single payer, Vermont would have to pick up the responsibility for all the people in the state over 65 and for all the low-income people, and there would be no federal funds available to them for that. Mm-hmm. And so billions of dollars every year that come into the state would cease to come into the state. Mm-hmm. And all it takes to fix this so that our states can do single payer, and like I said, we've got two that are primed and ready to go, is a very small tweak in federal law that provides a waiver basically to Medicare and Medicaid to be able to provide that money instead of to the recipients directly to the state with some oversight. And that change in law has been proposed a number of times. It's, I believe it might have passed the House the last time around. But that's the sticking point right now.
Sometimes I'll hear different versions of the following argument as to why a system that works in a country with 5 million people would not work in a country of 330 million people. And it's some version of, and I'm sure you've heard this, because the United States has so many more people, or so much more diversity in the types of people, you can't expect something that works in Norway to work in the United States. Now, from like a purely actuarial perspective, in general, the bigger your risk pool, the more predictable your expenses are going to be. So mathematically, I don't really understand that argument. What are the reasons why that's not a very good argument against such a system in the United States?
Well, let me boil that argument down for you, David. It's essentially the same argument that John Stennis was making, the Southern Democrats were making in the 1960s about why we need to have a 20% hole in Medicaid. And basically what it is Norway doesn't have a lot of black people.
Right. That's what they mean by different types of people.
Wow.
That's exactly what they mean.
Yeah. Wow. Wow. Well, the racism doesn't end. The endless the racism is. America's racism. Wow.
Wow. And is there, this has been looked at. In general, is it right to say that a much bigger risk pool overall makes for more predictable actuarial?
The larger the country, the more efficient and effective their single payer system would be. And the countries that have done it so far and done it well. Germany, I think, has 53 million people. France is in the neighborhood of 40. It's been a long time. High school geography here.
Yeah.
but the UK is I don't even want to guess what the UK is. But none of these countries are 350 million people, but the entire European Union is 850 million people, and to the best of my knowledge, every country in the European Union has some form of a national healthcare system. The one exception being Switzerland, which mandates everyone to buy insurance, requires the health insurance companies to be not-for-profits and the hospitals, and will pay your insurance for you if you can't afford it. So it's functional.
Wow, that's a great system too. Even with the private, you can't pay your. Even that system would do well in the U.S. Like, if you can't pay it, your bills. The government ends up paying it. I don't know how much percentage, but you know what I mean. But they have Medicaid, but Medicaid doesn't cover, or Medicare. No, Medicaid actually. Medicaid, right? Medicaid doesn't cover enough. That's why they wanted Medicaid for all. It was Medicaid for all. Medicare for all, not Medicaid. And Biden was gonna make it 50 years old. Now you have to be 65 to get Medicare. And it still is. But he was gonna lower it to 55 or 50. Yeah, that never happened.
The same thing, but their system is a little more of a kludge, and as a result, they have the second most expensive system in the developed world.
So that's not good, folks. So it's not a good system. Yeah.
Behind us, but it's still not even close to us. It's we're way up here in terms of what we pay, and then Switzerland, and then all the other countries down here.
Yeah, on that note, sometimes I will tell my audience about how different countries in Europe have different systems, and for example, Germany's system is not what we imagine Medicare for all would be. There's a combination, and sometimes people are combining what the government offers with some non-profit supplemental. France has a different system as well. I'm sort of agnostic in terms of exactly how it's set up if we get to universality and affordability for everybody. Do you think that it's a good thing to be open to looking at the different ways in which different European, and actually Singapore has a different system as well, that's probably worth looking at as well? Or do you think that it really has to be Medicare for all as envisioned by a contingent of those in the Democratic Party?
If you want to look at a country where it really works the best in the world, and there's no debate about this, look at Taiwan.
Okay.
Taiwan has a pure single-payer system, and because of that, they have a national medical database, and because of that, they were on January 21st, the day after we got our first COVID case a year ago, January. Mm-hmm. They got their first, the day after they got their first COVID case, and they were able to use that system to do contact tracing and testing, and kept their death rate for the entire year of COVID, the first year of COVID, kept it below 200 people, while Donald Trump let 500,000 Americans die.
Wow.
That's a system that works very well. I lived in Germany in the 1980s when their healthcare system was still largely 99% really just a single-payer system.
Wow.
What happened, and the reason why you're seeing all this so-called diversity, David, is that in the 80s there was this major project launched. It really was launched in 1978 by Margaret Thatcher in the UK, and but by the 80s it had become a whole new governing paradigm that is sometimes referred to as neoliberalism. And its core tenet is that government can't do anything right. As Reagan said in 1980, January 20th of 81, when he was inaugurated, government is not the problem, government is the cause of the problem, it's not the solution to the problem. And so, as country after country adopted what are called neoliberal reforms, and as the EU began to incorporate neoliberal policies, into their charter that required countries, for example, not exceed 3% of debt in GDP debt, of 3% of debt relative to GDP in any given year, etc. You know, the stuff that just brought Greece to its knees during the crash in 2009. As that happened, more and more countries started. One of the biggest pieces of neoliberalism, of course, is privatizing government functions on the assumption government can't do anything right. It's why more than half of our power and water in the United States is now provided by for-profit companies, which is also why, California burned and 83 people died in the Paradise Fire, which PG&E was convicted of, and why the high-tension lines down south going to New Orleans never got buried, because they had to pay their stockholders. But anyhow, that neoliberal infection was caught by a number of European countries, most notably France and Germany. And, the UK, I think, to a large part succeeded in
But France, what's going on now? You're definitely right.
pushing it away, which is kind of ironic, because so much of this started with Maggie Thatcher. But that's what
Yeah, it's ironic. Now it's, I don't know, a year later, it's coming back. It's coming back, folks. We know conservatives are really bad. And these guys are worse than Thatcher's regime. These conservatives nowadays.
you're looking at experiments in bringing more and more so-called free market stuff into healthcare, and many of them are just not working.
They're doing that here too. Good old Canada, yeah. Ontario, Mr. Ford, been bringing more private clinics and making more stuff that's used to be paid by the government. More, now you have to pay user fees. You have to pay more user fees now. Certain procedures. Now it never used to be like that. Now it's it's getting more like the US. Being a US style system here. Terrible.
Well, at all.
Yes, that is an understatement to say the least. We've been talking about Thom Hartmann's latest book, The Hidden History of American Healthcare: Why Sickness Bankrupts You and Makes Others Insanely Rich. Tom, I really appreciate you being on. Of course, there's this whole other side of the book about the medical bankruptcy and the profitability, which we should take up at another opportunity. But I really appreciate you being on.
Okay, folks. Yeah. That's it. How racism, America's racism stop itself. How American racism stop itself from getting single payer health care. Isn't that ironic? Wow. How the irony of this. Anyways, folks, that's it for this video. Till the next one.